Again, my name is Julie Atella, and I am a researcher here at Wilder. My colleague Amy Leidy and I are going to spend the next 20 minutes highlighting some of the findings of the recent assessment we conducted to discover why so few Hmong youth and adults living in the East Metro were receiving mental health services. Specifically, Wilder and Ramsey County were interested in learning whether the low use of their services was a result of the lack of the need for services or the presence of a significant access to service, or maybe something else completely, or maybe a combination of a bunch of different things. Some background information about prevalence, and if you look at the review of available literature estimates, the rates of diagnosable mental illness of those in the Hmong community is likely double or more of the United States population. For instance, mental health conditions may be higher due to traumatic war and migration experienced by refugees. These estimates of high needs, including the ones that you see on the screen, are limited to what is available in the literature, which is not always specific to the Hmong community, oftentimes because it is a lump of all Asian Americans. This project came about as Wilder's Child and Family Services and Ramsey County shared concerns about the small number of Hmong youth and adults receiving case management and other mental health services relative to the assumed need within St. Paul and the surrounding community. The key research questions that came out of our meetings with the advisory group were in these 4 areas: needs, barriers, access, and responsiveness. The first body of questions that the advisory group was wondering about was around need. For instance, what is the scope of mental health issues within the Hmong community? Is there a need for Western mental health services in Ramsey County for the Hmong? Next was around barriers. What barriers do the Hmong community face in accessing mental health services? And then also, where and how do Hmong families access mental health services in the East Metro? Third was around access. What is the availability of mental health services within Ramsey County for the Hmong community, and what mental health services are in the most need? And lastly, had to do with responsiveness. How can social and health systems within Ramsey County be more responsive to the mental health needs of the East Metro's Hmong residents? As I mentioned, the advisory committee felt it was important to talk to community members and professionals in order to fully understand how mental health is viewed within the community. Because of their guidance, the study was largely qualitative. In addition to reviewing the relevant literature, we conducted focus groups and interviews with over 150 people in the community. Most of the people we interviewed and did focus groups with were Hmong, and the interviews were conducted in both Hmong and English, and sometimes both. Our focus groups and interviews included talking to professionals who work with the Hmong and also who work in the mental health agencies, including school personnel, probation officers, child and adult case managers, child welfare and child protection people, and also administrative staff from Wilder. We also talked to a second group who we did focus groups with adult Hmong and adult youth who may have never even had mental health services, but we wanted to learn from them how these groups would access mental health services if they needed to, and also what their knowledge of mental health and mental health services were. The third group that we did focus groups with were adults and youth who had themselves or their family members had gone through mental health services or were familiar with these services. And participants were asked about their personal experiences with accessing and using Western services. They also were asked about their referral process and how those steps went, and any other barriers that they may have encountered. So what did we find? A great deal was learned from the discussions with the community members and professionals that we spoke with. On this slide, you will see the main themes or findings that came out of the assessment, which include the importance of recognizing cultural influences, how symptoms are different for Hmong, how there's a lack of knowledge of services and how to access them, and there's also a lack of services that are existing currently. And now I'm going to hand it over to Amy, who will go in greater detail about our findings.
So one of the major findings that emerged was that there are unique cultural nuances that make identifying mental health needs among youth and adults challenging given our Western concepts of mental health. The Hmong community is largely a collectivistic community with a strong emphasis on the family and clan structure. Study participants frequently discussed the importance of family within the culture and noted that the family or clan would be the primary source of support for a youth or adult with mental health needs. Youth reported that their parents didn't necessarily think that they, the youth, could experience stress as a youth. Youth also reported that they faced pressure to be successful in school and to maintain traditional family and gender roles. Additionally, many youth in our study discussed challenges with their roles as being a cultural bridge for their family. It wasn't uncommon that the youth who participated in our study were the members of the family who spoke English and who were responsible then for completing paperwork, for communicating with teachers and school personnel and things like this. So that was an extra burden on some youth. Hmong may be reluctant to seek support from outside their family or clan for fear of being ostracized or bringing shame to their family. This is especially true in more traditional Hmong households where there are strict gender roles, and women in particular may feel shameful seeking help. Hmong also have traditional healing practices, an example of which is the soul calling ceremony. Many participants said that there was a desire to work within these traditional, familiar, and trusted cultural practices as opposed to seeking services through the more Western mental health system. We did find through our study that cultural healing methods were more likely to be important to older adults and to those who had most recently immigrated, who had most recently arrived in the United States. Youth from our study were more likely to prefer a more Western approach to seeking services for mental health needs. It should be noted that community members and professionals that we spoke with often felt that a combination of both approaches, both the traditional and the Western mental health services, may be the most beneficial. And some individuals that we spoke with had actually successfully been able to combine those two different types of treatment. Within the Hmong community, the Western concept of mental health is not always embraced or understood. There are not terms or language to describe Western concepts of mental health. And terms and words do not easily translate into the Hmong language. Additionally, the Hmong concept of mental health is not viewed on a continuum as it is in the Western model. Instead, a person is thought of as either being healthy or being crazy, with really very little in between. Other factors complicate the identification of mental health concerns within the Hmong community. Hmong are more likely to express mental health issues through somatic complaints, such as complaining of headaches, fatigue, stomach aches, etc. Additionally, Hmong are also more likely to display internalizing behaviors. So youth, for example, rather than acting out or being disruptive in class, Hmong youth who are experiencing mental health issues may instead become quiet, withdrawn, excessively shy. These types of symptoms may be more challenging for someone outside of the culture to identify as potentially problematic, making it more challenging to then identify youth and adults who are in need of additional services. Accessing mental health services. There are some specific cultural barriers that may inhibit members of the Hmong community from accessing the more Western services. As we've discussed, there is considerable stigma surrounding mental health issues and a fear of bringing shame to the family or the clan. Shame and stigma can result in challenges related to confidentiality. Study participants overwhelmingly felt that it was important to receive mental health services from a Hmong provider. However, many participants also shared concerns about confidentiality associated with seeing a professional who was part of the Hmong community. That said, most participants, as I said, preferred having a Hmong provider. Additionally, there are system barriers that exist within the community. Referral processes are complicated. As we've discussed, Hmong often display symptoms of mental health in different ways. And usual referral sources, such as primary care or schools, may not readily identify a Hmong person in need of services. Additionally, intake and assessment processes can also pose challenges. These processes did not generally allow for a lot of trust building or relationship building. Instead, eligibility for services is generally determined at an initial meeting. This can be uncomfortable for many in the Hmong community and can actually result in a poor assessment. Without trust, the Hmong may be unwilling to disclose sensitive and personal information that is really necessary during the intake and assessment process. Additionally, many of the current screening tools that are in place are not culturally sensitive and may not identify Hmong in need of services, again, partially due to that different display of symptoms. Additionally, the Hmong also face a number of practical barriers in accessing services similar to many in our community. These barriers include things like transportation, cost of services, insurance, and other concerns. While not limited to these providers, some of the main resources for mental health services in the East Metro for the Hmong community are with Ramsey County, Wilder, and there are some programs at some different Hmong-specific organizations. You'll hear a bit about Wilder services here in a few moments. However, it's important to note that there are some important gaps in the availability of services here in the East Metro. Our assessment found that there was a lack of knowledge of available services among community members, but also among the professionals that we spoke with. Few professionals and very few community members knew what services would be available and didn't always know how to even access what services are available. Some of the gaps in the existing service delivery system. Hmong families often access the mental health system after a crisis or after a point at which symptoms have become severe. Early identification and intervention services are really lacking. There is also a lack of culturally competent and culturally specific services. Study participants, again, felt that the needs of the Hmong were best met by Hmong providers, as Hmong providers would be better positioned to take into account different Hmong cultural values, cultural expressions of mental health issues and distress, and different family dynamics. However, there is a lack of bilingual and bicultural providers within the community. This can result in a reliance on interpreters, as Hmong clients receive services then from non-Hmong practitioners. Interpreters may not be adequately trained in mental health to support clients and patients through treatment. Additionally, patients and clients may be less inclined or less likely to develop a trusting relationship with a clinician directly, given that the interpretation process takes time as an extra layer, and clients and patients often spend more time and have more contact with the interpreter rather than with their provider directly. Okay, so now what? Given all of this, throughout the assessment, we did identify a number of opportunities for action or some recommendations. The recommendations tended to fall in these 4 different categories around increasing awareness and education, increasing access to services, actually increasing services, the availability of services, and then enhancing what we currently have in place. The first category is around increasing awareness and education. As you can see here, we've identified 3 more specific recommendations. As I said, the assessment found that there really is a lack of knowledge and awareness of mental health and available services within the community. One option is to really develop some partnerships within the Hmong community, through building trust and rapport, and through building partnership with clan leaders, Hmong-serving organizations, and others in the community can really help to build some trust and to help get the word out around the availability of mental health services. Another option is to provide outreach and education directly to the Hmong community through schools or other community forums. And finally, having greater outreach of the non-Hmong professionals who work within the community, greater outreach to school personnel, to social service agencies, hospitals, etc. Those who touch the Hmong community have a greater understanding of how the Hmong view mental health and what some of their symptoms may be. The next area of recommendations falls under increasing access. Increasing access to case management is one option. There are a few areas under which access can be improved to case management, specifically through the identification of mental health issues. More professionals need to be able to identify the culturally specific symptoms. Additionally, through screening and eligibility, this is not currently a culturally sensitive process. There needs to be time for greater family engagement, more time for trust and relationship building, as well as some greater flexibility with service delivery, greater flexibility in delivering non-billable services such as transportation, completing paperwork, and acting in that cultural liaison role. Secondly, another recommendation is to change the current billing structure, perhaps offering an alternative billing rate for families with unique cultural needs to kind of facilitate that relationship and trust building time. Thirdly, increasing services. One such option for increasing services is to increase school-based mental health programming. School-based mental health programming reduces access barriers by reducing transportation and cost barriers, and it reaches out to families in an environment in which they are more familiar. It provides early intervention and prevention services by identifying those youth with needs early before symptoms become too severe. Another option is to increase the availability and use of family therapies. This can be an especially effective approach given the Hmong culture and the emphasis on the family and that more collectivistic kind of group element of the culture. Additionally, increasing the availability of alternative therapies and culturally relevant activities. These types of services can help address some of the more somatic complaints. You'll hear about a couple of these types of programs that Wilder is doing here in a few moments. The fourth recommendation is really around enhancing the current service delivery system. These couple of recommendations really look at the workforce, having some opportunities to increase the number of Hmong providers. As I said, community members definitely stated that they had a preference for working with a Hmong provider. In addition to increasing the number of bilingual and bicultural Hmong professionals in the workforce, also offering training for mental health paraprofessionals and interpreters, ensuring that they are fully prepared to deliver mental health services and provide that interpretation in a helpful and comfortable way for patients and clients.